Loading. All right, fantastic. All right, we are live, and we are excited about the conversation that we're having today. If our astute viewers recall, recently we had a conversation with Ann Goldman at Multicare regarding interoperability, where we really got into the nuts and bolts of these standards that connect systems and allow for unified experiences. So we're expanding in that direction with this concept of the patient 360 healthcare ecosystem. A lot of words, and I know that there's been the 360 experience has been a buzzword that every vendor has said over the past. But what we're sitting down here with right now is Matt Gretczko from Silverline, Salesforce partner Silverline. Hey, Matt.
Hey, how are you?
And this is some terminology that they've come up with just based on some experiences that they've had with a number of hospitals in the market. So what we wanted to focus on is kind of unraveling the mystery behind that term and really getting into, last time we spoke about some of the standards and the technologies around it. But here we want to get into what that experience means for patients, what a good definition of that experience is, and give advice, thoughts, and things like that for people who are trying to enable connected experiences within their own health systems. So, Matt, we're really thankful that you've come on here today. And just by way of background, Matt has more than 10 years of experience enabling digital transformation projects in healthcare, starting with Deloitte and moving on into various roles. Finally, been at Silverline, leading as the SVP of Healthcare and Life Services and Life Sciences, leading that for the past 6 years. So we're really grateful to have you. And also have to introduce Mike Leonard, of course. He's the CEO of Symphony RM. And the reason he's excited about this call is he brings a tremendous background enabling next best actions, not only in healthcare, but in telecom, finance, and other industries. And he's got a wealth of knowledge to share about how the parallels between those other industries, what leading players are doing, and that relationship to healthcare. So, Mike, any words before we get started?
No, excited to be here, and thanks, Matt, for joining us. I think the kind of real world perspective on what customers are actually doing and measuring and implementing is invaluable to add to the theory of where things are headed.
For sure, I agree.
Fantastic. So one thing that we're months ago, but the big focus is to break down the barrier, break down the wall between people that are making change and leading these major efforts in healthcare. We've actually got some comments coming in already. And what I want to encourage is, if you have any questions or if you have anything that you want to share, comments, questions, this is a chance to network. You get to meet several of your peers at the same time. And we're well ready to answer anything that you throw at us. So if there's any questions or anything that you want us to expand on deeper, feel free to keep those comments rolling in. So we just want to say we're really happy to have you here with us, and we'll go on ahead and get started. So the big question, just starting out with all these different conversations around 360 experience and 360 patient profiles and all the different language that people have out there, I think it's helpful to come at a stable definition of what that term actually means. So, Matt, just given your background enabling this at so many health systems with Silverline, how should we be defining and looking at this concept of a 360 ecosystem?
Sure. Well, it's a great question, so I appreciate you asking it. I think there's a number of different things that I'd like to speak about regarding this. First off, I think what's really, really important to understand is establishing a 360-degree view of the patient is really only a step in the process, right? In order to do this right, you need to do a lot of analysis around what are the inputs to that holistic view of the patient. And ultimately, what are those outcomes or actions that you're trying to facilitate because of that, right? And so that's a really, really important concept, right? If you just think that, okay, I'm just going to take a bunch of data, push it into one place, and that's going to work, that's not really going to get the results that ultimately you're looking for, right? And so it's really important to think about what are the actions, the outcomes that you're trying to drive, right? The other thing that we need to think about, right, is based on that data and information that you have, what ultimately is the right way to expose that information about the patient, and who are the individuals within your organization that need to see that information, right? And often, a lot of the solutions that we deliver around create sort of this standard baseline of patient 360, but we curate the view into that information based upon who that audience is, who that stakeholder is, or the job or role that they have within the organization. And so when someone says patient 360, there's a foundational need to make sure that you're consolidating information across a variety of different systems. Those may be clinical systems, those may be population health platforms, those may be practice, et cetera, data warehouses. So first you need to establish what are the source inputs, right? Then you sort of create the model or the data construct and the application that's going to be able to store that information and expose it. Now you start talking about, based on the role, based on the experience that individual needs to have, how do we want to curate that experience? And then finally, you get to what's the most valuable aspect of a patient 360 is the execution of actual activities, right? Obviously, with Symphony RM, you have the ability to execute on next best actions. Other things that we're able to do for organizations are things like facilitating other workflow, things that hit the revenue cycle, things around scheduling, things around billing, right? Things around direction, whatever those inquiries might be from patients, it starts from having that really holistic view of that particular individual. Ultimately, our goal is to allow you to engage them in a way that not just only creates meaningful interactions, but that those are traceable and trackable, and ultimately that results to better outcomes, right? And so, patient 360 is not a simple concept to achieve, but it's something that requires thought. But if you do it right, we're seeing that there's a scaled approach to get there. And day one, it doesn't mean that patient 360 is I have all data for every single aspect of a patient. It means you're being thoughtful about what data to start with and why you want to start with that information.
Matt, I have to say I really like that answer, because it takes it away from being a question of, do I establish this data warehouse and bring all this data to one place and call that a 360? Well, you might have a complete perspective on the data, but if it's not framed in context of what kind of behaviors are we trying to influence and what do we want patients to actually do, then it's kind of like a 360 road leading to nowhere.
Correct. For better or for worse, data is a critical input to the success of solutions nowadays. And I don't think everyone has to be scared away by the complexity of data. It's about just doing the appropriate analysis so that it becomes valuable.
Excellent way to frame it up. And Mike, just given your background in enabling this experience cross industry, what are some experiences that you've seen? Have you seen some organizations being more focused on one aspect than they should be, and maybe losing sight of the experience?
Yeah, I think Matt said it really well. You have to start your customer 360 journey, so to speak, with the end in mind. You have to think about, what are we going to do different as a result of the data that we gather, right? Is there a specific user who's going to use that data to make some decision? Is there a trigger we're going to set to digitally reach out and engage somebody? You have to start with the end in mind. And part of that also is figuring out, users don't want to be inundated with data. Just because I collected 200 or 300 data fields about a patient doesn't mean every user of my system should log in and be overrun with 200 to 300 data fields, right? If we can do some crunching of that data and present them the next best action or the recommended thing we'd like them to do, that's immensely helpful. So,
and if I could add one more comment that I think you're sort of alluding to that's really important, and I always like to give customer examples because I think that really brings this, resonates. We had a customer that's in the payer space, and one of the things they wanted to do was to bring forward a lot of information that was historical claims information, right, and prior authorization information. And one of the paradigms that we had to shift for them, and this is where data and experience and Patient 360 goes into sort of the user experience, right, is they said, well, that's claims information, so it has to be over here, and that's prior authorization, and it has to be over here. And one of the paradigms we had to help them shift is the end user shouldn't know or shouldn't care where on the screen it is because of the source of the data. If you're doing it that way, you're doing it wrong, right? What you need to focus on is the experience of the user, the workflow and the activities they're trying to perform, or their audience, their customer. What's the experience you want them to have? You should not be structuring an application around just because that's the source of the data that needs to all be in one place, right? That is the beauty of the cloud-based technologies that we work with today, Salesforce and others, that allows you to actually not dictate the data to be in one place because it's from one source. It's let's actually expose the data in a way that helps facilitate workflow. And so I think that's really, really important as you think this through as well. That's a very big shift from historically what's occurred in healthcare of this tab is this information, that tab is that information. No, align it to a use case, align it to an experience or a workflow. It doesn't really matter to the user where that information is coming from, as long as it's accurate, it's timely, and it's validated, right?
The other thing I might add quickly, so one is, what data, the other one for me is thinking about if the goal of the data is to engage the patient, the member in a conversation to influence their behavior, right? There's a lot of data that we don't think about immediately. So claims data, EMR data, of course, right? But number of calls to the call center, right? Are there grievances going on? Are they interacting with us via text message? Are they showing up a lot on the website if they filled out a health risk assessment? All that data helps inform a dialogue that you want to have with your patient/member. And so one just really simple example, if someone has filed a grievance against us and they call into the call center to make an appointment, if normally on that appointment call, we might end the call by saying, hey, I noticed you are also, or Dr. Mike was looking at your file and he noticed you were also past due for an A1C test. Right? If someone has a grievance against us, it's not the right time to bring up something different. It is the right time to say, oh, hey, I see we may have had a service failure here, and I want you to know that we're working hard to get it rectified, and we're looking into it, and we're aware that we let you down a little bit maybe. But being aware of everything that users are saying and all the channels, all the CRM data that normally falls on the floor is critical to getting the dialogue right.
Yeah, and to go into one final comment on this topic, right, is what it also does is if you start to look at those other data sets, it helps you prioritize where you might want to spend your time, right? So, for example, we had another customer that, one of the things that we never encountered until we started to work with them, they were a large, multi-specialty organization with, various locations. We got in there and realized that a large volume of their inbound calls was actually around prescription refills. And no one said, hey, let's do something with prescription refill data. That wasn't the reason why they went with the CRM. But once we identified that a high volume based on looking at the data of their calls was from that, ultimately what we were able to do is, that data was already flowing to their EHR. The EHR knew when the prescriptions were refilled, and we said, hey, if we create a journey, an experience for those patients that says you don't have to call in, we know that your prescription's been refilled. While that might seem really simplistic, there's a very significant decrease in inbound phone calls because of that. And so again, your point, Mike, you're not always going to identify every single data element. It's not always going to be the standard clinical information. It's what can you do with the information you do have that ultimately has a distinct impact. And in that scenario, if you can decrease a significant amount of inbound calls for something like that, that frees up the line for individuals that might have a legitimate health concern and illness, et cetera, and really improve the experience at max.
So what you guys both hit on is context and prioritization that the 360 experience enables. And I thought that it kind of lined up with a question that came in from Kathy Rhodes in our audience, basically asking about if experience are determined by the types of campaigns or engagements that they're developing. So I thought that a really good direction to take this. So we're talking about the overall concept of what the 360 is and enabling contextual experiences that are properly prioritized. But let's get if we take a step back, what kind of problems do you see this actually solving? So just like considering we have an audience that's focused on engagement and influence, just curious, like what kinds of problems do you see the 360 experience solving? And what kind of experience does it create that complements these efforts that they're trying to do?
Sure, I'm happy to give my perspective. The first piece I'd be very open and direct about is I think that, if I bucket problems in three areas, operational, technical, and clinical, right? Let's just, for argument's sake, say those are three buckets. Typically, as far as Silverline is concerned in the work we do, while things we do may ultimately impact clinical, we're not generally on the heavily clinical side, right? And which is expected. We're implementing, a CRM technology, right? But the actions that someone might take ultimately won't prove to help. But if we stay on the operational and technical side of the house, right? Ultimately, the problems that this helps solve are being able to more effectively address, concerns, challenges, or inquiries from patients, right? And if you think about it relatively simplistically in that way, that starts to hit a lot of different processes, a lot of different workflow, a lot of different activities that the organization is ultimately going to care about. And so that 360 creates really that foundation for engagement, right? And ultimately, as Mike outlines very astutely, right? One of the things that you have to focus on, though, is in order to get to the point where you can really make that improved impact, you also have to make sure you can do some of the baseline capabilities as well. So what problem might it solve? That you actually know who's calling you. That's actually a foundational problem that many organizations have, is they don't actually know that someone called unless you document something in the EHR or document something in another platform. So by having a patient 360, you can have a really nice starting point of just being like, I know that Matt Gretczko called, I know why they called, I know when they called, and I know how many times they've called over X period of time. I also know that we've emailed them and I've sent them text messages, et cetera. And so you start to understand how that really solves a problem of understanding who they are. Once you understand who they are, you have the ability to really start to address any of those challenges or inquiries that they have. That's the second piece, which is the more information you have, the more that you can get into an enriching conversation with them. When they call in for one question, how can you possibly address two other things at the same time? Mike, you said you can frame the dialogue in a different way based upon the information you have and make sure you're not trying to convince them to do an appointment if they have a grievance. The same is true, though, if they're calling to schedule an appointment, and you also notice that they're scheduling an appointment because they don't feel good, but they also haven't had their flu shot. Well, that's a good opportunity to tell them about getting a flu shot, right? Or it's an opportunity to tell them about something else. And so I think the foundational problem we're solving is being able to know who your patients are, how you've interacted with those patients, and be able to better address the challenges, concerns, and inquiries that they have. The final piece of this is based on the interactions with that individual, how does that change your behavior and your strategy with them moving forward? And again, that's before, during, and after care, not just every time there's a clinical episode. So now that they hung up the phone and you scheduled an appointment, what is that next experience that you want them to have? And ultimately, without going too far, this is where you start merging into the digital front door and sort of your digital experience out of house that says, okay, well now also, how do I give that same capability from an inbound call, but proactively from a self-service standpoint, so that people can actually do some of these things on their own, because that patient 360 has now been pushed externally to the patient, which we all know is the holy grail of exposing their information, what you know about them, to them to help them inform better care. Does that make sense? Hopefully.
Yeah. I mean, I love the way all the things you said. I mean, the way I think about it is our goal is to design personalized lifetime journeys, right? Personalized means we need a lot of data, and lifetime journey means it's each individual journey, but also over the course of the lifetime, you're going to have acute incidences. You're going to be healthy for a long period of time. You're going to develop some chronic things that will linger. We'll maybe solve them over time. But personalization is critical to driving experience. And I think healthcare needs to look to Netflix, to Amazon, to these other industries that have nailed personalization with 1/10 the data that healthcare has, 1/10 the lifetime value of a customer that healthcare has, but just a relentless focus on it, right? Right now, if the three of us each pulled up our Amazon pages, they look different. Right now, if the three of us called Chase to cancel our credit cards, we would get different experiences because we have different lifetime values. They have psychographic profiles of us. They treat us differently, right? And healthcare needs to get there. But I think we need to keep in mind that the customer 360 view is one critical component into the personalized lifetime journeys that allow us to drive delight and loyalty among members in addition to health.
So I like the frame up of that, and it gets me thinking. Actually, I'm thinking just even from the audience perspective. I'm curious if anybody has any thoughts in the audience on the types of challenges that you might see a 360 experience solving. I'd be interested in if you just drop that in the comments, and then we can see even some different perspectives there. But at the same time, when you lay out the fundamental challenge of even knowing who's calling and having some context behind them, it just seems like something that's so basic that my question then is, why isn't everybody doing this? What's stopping organizations from enabling or pursuing that type of experience?
Yeah. Look, I mean, if we're being honest with ourselves, I think there are legitimate reasons why certain organizations have not yet achieved sort of this level of engagement and maturity, right? That might be due to, funding levels. That might be due to other restrictions that they have based on size and expanse, et cetera. So I think one thing to understand is that this is a journey. I think Mike said that well, right? You don't get to patient 360 day one, but you need to understand that path you're going down, right? So the first thing is recognizing that everyone can do this. Why they're not may be factors that just need to be addressed directly and reprioritizing of where and how investments are being spent, or where ultimately the patient needs can be met where they are, right? But if we sort of scale that back and say, okay, well, everyone has the same opportunity to sort of do this. Why isn't everyone doing it? I think there's a few reasons from my perspective, right? One, I think there's a lot of different options in the market, right? There's a lot of different products, a lot of different applications, and that's also often very difficult to navigate. And in healthcare, why that becomes even more burdensome is healthcare has historically been a very point solution focused industry. And what I mean by that is if you have a particular problem, you buy an application to solve that problem, right? And it probably does a really good job solving that problem. The question is, what if you, instead of buying a one-for-one scenario, you said, I have 6 problems. Can I find an application that can solve those 6 problems? And I think that's where the organizations that are doing this today are starting to have that mindset, right? They're saying, I need to solve multiple problems with one application. And so how do I acquire an application that lets me really do that at scale? Because ultimately, that's where I'm going to get the ROI. That's where I'm going to get the biggest bang for the investment that I'm making. And by the way, a lot of the effort or outcomes I'm going to see from that, Mike mentioned loyalty, are things that outside of hopefully improving the actual care and the level of engagement, is also going to lead to things like loyalty, which is something you can track and actually say, okay, now we see a direct line between making those investments. So long story short, the first op really is just navigating all the various applications that exist out there. I think that's a really big piece. 2 is just having a little bit of a roadmap or a blueprint for how to do it. A lot of what we do for customers, the question is, this all makes sense, but how? Well, a lot of what we spend doing is helping organizations understand the how, right? We bring forward a roadmap for them. We bring a blueprint to them and say, you're like this organization that we worked with before. This might not be 100% of the solution you need, but it's probably really close. So tell us where you think your business is different. Tell us how you operate alternatively, right? And so I think that's the second, challenge that ultimately happens. The third, and while the focus of our conversation today is certainly not, COVID-19 and the pandemic, it brings up the concept of prioritization, right? Ultimately, we found that a lot of organizations have just not prioritized this for no other reason. If you look at sort of, any public institution or organization does what's their vision, what's their top goals for the year, there's no reason now why, if you are a healthcare organization, patient engagement, digital transformation, right? These type of strategies and approaches should be the main thing you're focused on if you're looking to make a technology investment outside of course, delivering care. There's a lot of things that are standard, but I think that's one of the challenges as well, is just identifying that this is something that is no longer, I think we've said in a number of things that we've published, this is no longer a differentiator. This is required. This is required to do business now in healthcare.
Yeah, I agree. I think if you just step way back and look at other industries, right? Right now in healthcare, traditionally, the stuff we're talking about today is not easy. And healthcare, there's a lot of things they can be doing, right? A lot of things. And so unless something's a burning platform, there's just not time for it. And so if you look at an analogy, right, Blockbuster was a huge business. And it was, I would say as an analogy, it was a fee-for-service business, right? It was transaction-based. They made money off of late fees, and they got really big. And it wasn't until competition accelerated, business models changed, Netflix came along and turned it into a membership business, right? At that moment, Blockbuster had a burning platform, right? And then they started moving aggressively towards how do we move online? How do we do a membership model? How do we get rid of late fees? And I think we're at that moment right now in healthcare. The burning platform that will force CRM is happening. I think the 2 things are value-based care models appear to be here to stay, and they're accelerating. And 2, competition is accelerating like mad, right? If you look at Walmart, CVS, Amazon, One Medical, all these companies are coming in, and the fight is for customer relationships. It's for patient relationships. So the initial battle is around primary care. How do I go insert myself into the primary care flow? And primary care ultimately will be about more than an appointment. It'll be about all the time between the appointment where we stay connected. And if you look at the way One Medical does that, they do some really neat things. And you can imagine that with all the pile of data that people like CVS and Walmart have, and all the creativity and they're going to do some amazing things too. So I think, Chris, why haven't we done it traditionally? I think we didn't have the burning platform, which we do now. And then within that, I think, and I don't know the right analogy, but we've got to work our way up Maslow's hierarchy, right? Step one is digital front door. Can I just show up at the website? Can I find a doctor? Can I make an appointment? Can I pay a bill? Right? If I can't do those things, then personalization doesn't matter yet. So we have to start with just getting that in place. I have to get a call center up that allows you to schedule, right? To me, the early instance of a call center, you can tell by what they're measuring. If they're measuring average call handle time, first call resolution, if that's what they're measuring, well, then they're early in their development. Right. An evolved call center thinks about, how do I create value on each call? Not, I want to get off the phone in under 3 minutes. No. I want to actually serve this customer to the fullest. I want to create an experience that's valuable for them and actually probably has value for us too. How do I invest in this call? Right? And so you start to measure value per phone call. So I think we now have the burning platform, and now we're working our way up the hierarchy of getting the infrastructure in place. And, I think companies like Silverline are invaluable to the world as they go around and say, hey, if you try to do this on your own, you're going to make all the same mistakes people have been making for years. But if we can bring some learning from other industries and bring some learning from other healthcare companies, we can accelerate you through this process.
Yeah, and I think, and just one final comment, Chris. I think agility is a word that I think is really, really important here, right? If I think about the healthcare organizations that we worked with, right, and again, to reference, the current pandemic, those organizations that invested in particular CRM technologies, right, technologies that allowed them to do some of these activities, they had the ability to be agile. We had one customer that was able to stand up a dedicated COVID-19 patient access line in 24 hours because they had the right technology in place. We had another organization that when they had to mass close all of their urgent care centers, or they had to roll out telehealth when they didn't have that capability and email tens of thousands of patients, they had a technology to allow them to do that at scale and create that journey, right? And so again, to your point, Mike, around a burning platform, we're there. But what I also think we're seeing is those organizations that were earlier on in that curve had the agility to address it. Doesn't mean they did it perfectly or flawlessly, but now they're like, wow, I made a good decision. How can I do that now in steady state, where it's not because we're in a pandemic that I need to leverage this technology? It's I actually want to have more proactive, thoughtful experiences, right? At the end of the day, I think loyalty, consumer relationships is really, really important here. You mentioned competition. Not only is there competition from acquisitions and more players, but you're seeing that providers are not the only organizations delivering care now, right? Payers are delivering care. Pharmacies are delivering care, right? And when that model starts to emanate, you are going to have to pick where you go. And that's going to be based on the experience. That's going to be based on who knows the most about me and is curating that in a way that I think is productive and helps me stay healthy.
Well, I might make one, may sound strange, but one observation. Healthcare is fundamentally different today than every other consumer service industry. And I think it's going to change. And the fundamental difference is, in every other consumer service industry, the person who owns the customer relationship is the one who makes the most money in life, right? Is the one who actually gets the most value. So you look at Apple, right? If I look at my phone, Apple owns me, and all the app providers pay Apple 30% for the right to talk to me through Apple, right? If you look in financial services, everybody who wants to sell me a fund has to go through my bank and pay a fee for the right to market to me. In healthcare, we're upside down. The primary care group is where the least amount of money is made, and it's all the specialties behind them that the providers make the most money on. I think if you look out 5 to 10 years, there's a good chance that flips. There's a good chance that the people who own that relationship will move their patients across specialty providers and look for the lowest cost. Now remember, lowest cost is outcomes driven, not just dollars driven, right? but they'll look for the lowest cost. And I think when you see people like Walmart, CVS, I've mentioned One Medical a few times, when you see people inserting themselves to try to own the relationship, that's what they're trying to do, right? They observe that in any other industry, that's where you win.
So I got a couple of comments that I thought were interesting and kind of related, especially Jared Johnson of the Healthcare App podcast comments that the fight is for consumer relationships. And that was kind of at the time that you were discussing the burning platform, really emphasizing the need for change. And I think that when we're thinking about consumer relationships and the relationship that the approaches that health systems have had in the past to foster and nurture those, there was a relevant question that came in, which was curious to know how healthcare's massive shift in recent months is going to impact how healthcare organizations look into what they want to do with CRM platforms, how they'll be utilizing those platforms. And
yeah, I mean, look, I think someone made the comment from some of my previous comments, and I think it's worth reiterating, right? I mean, I think, again, it's creating an action-driven solution, right? It's focusing on the actions and the outcomes you're trying to drive. Ultimately, that is where we think CRM platforms are going to move to, right? And so it's creating those actions, but it's also becoming that launching pad for that digital front door experience, that self-service experience, that virtual or remote experience, right? I mean, I can't tell you how many of our customers have said, this move to telehealth is not a point in time. We are there now, right? Telehealth will be a much more significant part of our business moving forward. Okay, well, many organizations put some rough patch in place. They said, okay, we signed with this vendor, but they didn't integrate that into the experience. They just said you have telehealth. Well, now it's how do you integrate that into the experience for the patient? And so for me, as I said, one, I think it's going to be required, not a differentiator. It's going to be required, as we've all said, and everyone on this call knows, because of that competition and because of the requirements from the patients and the consumers, you will have to provide these type of capabilities. And the second piece is when you look at whether you have a CRM platform today, how do you expand that? If you don't have a CRM platform, you're going to have to invest in one. And if you think that you have another application providing CRM, you really have to challenge whether the way in which they're saying you can achieve the same goals is actually feasible and producing the results that you think really align to what you're trying to do organizationally. But no doubt, to Mike's comment, burning platform, this pandemic and a variety of other external market factors, either shift to value-based care, et cetera, have really shown that having this type of application is critical to those organizations that want to drive engagement and win the patient. At the end of the day, we don't like to think about it that way, but ultimately that's what we're trying to do.
Yeah, the other thing I've seen that is a big deal is it's shown people the importance of communicating with their members / patients on an ongoing basis, right? We used to think about, and a lot of people still do think about campaigns, and I run a campaign every 2 to 3 months, and I focus it on one product, and so I target maybe 10% of the existing members to whom it's relevant, plus some people in the community. Really, every other consumer service industry is thinking about how do they get a pace of dialogue with me, right? I think Netflix reaches out to me once a week with new movies, new content I might be interested in. My bank reaches out to me once a week with updates on my account or updates on the market or things I should think about refinancing, right? They're always thinking about me. Healthcare really doesn't do a good job of proactively using that conversation, but COVID forced people to think about, now we have telehealth. Oh, we don't want people to come into that clinic. Oh, we've got a testing facility over there. Or suddenly we needed to be proactive. And I think the health systems that I saw do great, right, increase their proactive communication by 5 to 6x. And I think Chris, you and Yuki at our place put out a piece that showed people who started increasing the pace of communication saw an increase in engagement per communication.
Sure.
Right? Which I know a lot of health systems were afraid and said, well, we better stop with reaching out because people are focused on COVID. And I think the right answer was the opposite. No, reach out. And the health systems who did saw great results. And I have to say, you got to think about it. The battle is for the customer. And if you're not reaching out, somebody else is, right? And that's not what you want. So you need to be thoughtful. You need to personalize the reach out, but you need to be proactive.
Yeah, and I think one nuance on that as well that I think is really interesting that we've seen is it's not only about the proactivity of the reach out, but there's also opportunities to improve the reach out itself, right? So just one really important example as we think about the consumer is, if you think about children, right? And you start thinking about, a parent, especially during this time, might have 3 children that all have to come in for an appointment. One of the things that we're also seeing those most mature organizations think about is not, can I send an email telling them about their appointment? It's, I know that they have 3 appointments on the same day and they're all children of the same family. So do I really want to send 3 separate emails, or can I send one email that says Matt, Jack, and John all have appointments at 9, 10, and 11, right? And so to your point, Mike, it's about those that are staying informed, staying consistent and relevant, but it's also about being thoughtful about the pace of those dialogues and the content of those dialogues to make sure that every interaction is rewarding and valuable, right?
And thank you for that. And to Mike's point, just about the study that you and I put out, if you go on our LinkedIn page, you can scroll down a bit, and what you see is an image that analyzes 2 million emails since October. We saw interaction in terms of clicks, in terms of open rates for emails spike in March as the pandemic was onset. And we're thinking that level of engagement, if you look, there's other surveys and other studies that focus on what people's most trusted healthcare resource is, their most trusted resource for health information. And really, it's the people that are watching this webinar. That people are focused on what kinds of communications they get from their healthcare systems. So as we go through this, we're not in a post-pandemic world. That I think that conversation is over. It's a question of how are we going to manage all this uncertainty moving forward. And what we're learning and what we've seen from that initial study is that the people who are watching this, the provider organizations, are that voice, and it's important to be in front of them. So we actually make resources available for free to be able to communicate some content and things like that. But it was an eye-opening study.
Yeah,
So,
I mean, if you think of it from a pure human capital perspective, right? If you're part of an organization and you always want the confidence of your executive team, of your leaders, right, to say, hey, how are we going to get through this? What's going on? Constant communication, valuable communication. Your patients are your human capital, right? In that respect, right? And you need to think about them that way. They're looking for you to help them through this, right? And so that constant communication, that constant outreach shows that you care, right? At the end of the day.
One subject that you guys brought up was how much faster decisions, the pace of change is happening, where telemedicine was debated for a long time. And now, boom, as soon as the platform started burning, there had to be a fast decision. So one thing that concerns me about the history of CRM and the history of large implementation projects in general is sometimes like if there's a project that's pretty big or tremendous project, then you can have a long time before there's any kind of value that you can start reporting back. So we were talking about metrics a little bit earlier. I'm curious about, with the need for quick wins and showing value, how can leaders get started and show early wins on projects like this, 360 type ecosystems?
Yeah, I mean, look, it's a great question, right? I mean, I think at the end of the day, the best advice that I'd give, right, is to have a thoughtful roadmap, right? Where are you starting and where are you trying to go, right? And I think if you start a project with that mentality, you can identify ultimately where is the right place to start, what are the areas. Very important is to create a foundation first. But I will also say, and this is a good opportunity to change, a misnomer, right? I think many organizations believe that this is multiple millions of dollars and multiple years to accomplish this. That is not the case. Silverline specifically, we've recently released a number of different what we call solution bundles, where we're able to set up an entire framework for Patient 360, as well as solve many other problems like scheduling support and patient inquiries, right, and provider network in 3 months, right? And so I think part of it is also coming to the realization that these are not always massive investments, massive timelines. If you're thoughtful about the approach, you understand where you want to start, and it's going to be a process over time. Ultimately, I think you can identify those quick wins. And as I stated earlier, sometimes those quick wins are things that, while they might not be known today, they ultimately are the ones that are going to have the highest ROI. So for example, if you roll out a patient 360 and the first thing you're able to do is at least know who called, that is an incredibly big win, right? That is a very big win. And it does not take a lot of effort and time to be able to do that, right? However, on the flip side, if your strategy is day one, I want to make sure that I'm increasing revenue by $65 million because I want to increase scheduled appointments from 18% to 46%, right? Those aren't realistic metrics, and you're not going to be successful, and you're not going to realize the value. And so I think it's being thoughtful on your roadmap, having realistic metrics that you can track over time, and ultimately identifying what the right technology is to get to them.
I think there's bad news that actually in the end is good news. So in healthcare, 99.999% of my relationship with my health system is outside of their four walls, right? And I would say that most health systems around the country are really, really good at taking care of patients when they're inside the four walls. They just are, right? And we should give them credit for that. We should acknowledge that. But the bad news, as I said, is I'm only in there for a very small portion of my relationship. The good news is that we're so far behind other industries in addressing that other 99%, that there's a lot of quick wins there. And the only mistake you can make with the quick wins, I think Matt nailed earlier, is to think of them as one-offs. You need a partner, whoever it is, you need a partner who can help you say, here's the context of the path that we're on, the roadmap of execution that we're on. Within that path, let's go pick some quick wins that give us momentum, but let's not get off the path. Because if we get off the path, we risk looking up one day. And one health system we worked with called me one time and said they had 247 different software vendors, right? And now they wanted to start to bring things together and talk across systems and architect the member experience across systems. Well, at that point, it's pretty rough. Okay? So there are a lot of quick wins, but you need to make sure you've got someone who's got you on a good path going forward.
So we are actually a little bit over time, 12 minutes over time. So I appreciate the audience for staying engaged, because this is some really interesting and powerful stuff. But with, Matt, you mentioned earlier, you were talking about the formation of a roadmap and making sure that there were identifiable steps that were realistic and wouldn't overwhelm the project. So really, I was curious if you'd like to dig in just a little bit more on what a good roadmap looks like and what types of metrics organizations should be focused on.
Absolutely. Yeah. So, I mean, I think, it's the inputs to the roadmap that I can speak to, right? Not necessarily the details without knowing, So I think there's a few inputs, right? First, what technologies, Mike just said, what technologies are already in place and what are being considered and possibly sunset because of this initiative. That's very, very important. Another input is having stakeholders across the enterprise. This is challenging, right? I will tell you, many of the times that we do advisory for our customers to establish roadmaps, one of the best pieces of feedback that we get is not, thank you for creating the roadmap, thank you for helping us implement Salesforce, et cetera. It's, thank you for getting our executives in the same room together. That is the feedback that we get. And so getting executives that represent the clinical side of the house, the IT side of the house, the patient experience side of the house, all within the same room is a very, very important input. The third input is the metrics themselves, Chris, right? Understanding, do you have a baseline set of metrics? And we all have to be honest, many organizations won't be able to give you baseline metrics. That's part of the challenge. They do not have the capability here today to have baseline metrics. So if they don't have a starting point, at least identify what you want to start tracking, right? And so the metrics become the third input to it. And the fourth input to it is, what is the realistic timeline and rollout strategy, right? Are there obstacles or factors that you need to consider, right? Many times for any payers that we work with, right, you think about open enrollment and you say, okay, is open enrollment a great time to go live with a fundamentally new member or agent experience, right? Same thing from a healthcare perspective, right? Based upon where you are as an organization, you want to factor in when and how is the best time. So if I just sort of recap those inputs, right, have, multiple stakeholders, what are the metrics, what is the application landscape, and what are some of the other obstacles or considerations that you have at your organization that you want to factor in? Those are things that we think are all critical. The final piece of that is obviously if you have multiple stakeholders involved, you need someone that is the champion at multiple levels of that organization, right? We speak when we do projects with customers about a product owner. That is the individual that is making all the key decisions. It can be by committee behind closed doors, but that individual is interfacing with us to make key decisions. And so having a champion that not only can make decisions, but throughout the entire organization, top to bottom, people are going to help be those change agents, help be those people that are endorsing that this is important to the organization. So I'd say if you start there from a roadmap, whether it's a 6-month roadmap, 12, 18, or 5 years, if you don't have a lot of those critical inputs, ultimately you won't be successful.
You know, one thing that you said, it kind of begs the question. So you said that people say, thank you for even getting my executives together in the room in the first place. So it begs the question on, could you give me an example on something that has worked or a common approach that you use to get that conversation to even happen?
Yeah, I mean, one of the things, it's a formal request we make. It might seem silly in this time and day, but, Silverline is an organization that believes that we have a validated approach to making customers successful. And so we do make, just as much as customers make requests of us, we make requests based on our experience and our best practice approach that says these are the things that we need for us to collectively be successful. So we actually do request that certain individuals are included. And that's something that we hold our customers and clients accountable. We think ultimately, if you set that standard up front, you find that if they're involved in the road mapping portion, that means they're going to be involved through the implementation. And that means they're going to be the people driving the adoption and the change management as it continues on. And so we do see that ultimately that is a critical success factor for us. And it's just a request that we make of our customers. Oftentimes we will help our customers build that value prop with those executives, right? How do I, if I'm the VP of patient access, how do I convince the CFO that this is an initiative we do? And so we'll help them frame that up. We'll help them identify what others have done. What are the value props? What are the drivers? And so, it's a very thoughtful and at times time-intensive approach. But ultimately, I don't think anyone wants to, deploy a technology solution or any type of application, and then a few months later it becomes stagnant and say, yeah, we got some things accomplished, but it's on the shelf now. We really want to make sure that this ultimately transforms the way these organizations operate. And so, executive involvement is critically important, not easy, but it's certainly important.
So Chris, I'll add one really fast and really specific one. A lot of systems that we talk to would like to drive more primary care appointments, right? And so if on the surface that seems easy, well, let's go into the market and talk about primary care appointments. But the reality is it's not that easy. The best people to focus on if you want to drive primary care appointments are the people that you already know who need those appointments. So either have chronic conditions and aren't coming in, or high propensity for referrals and aren't coming in, or one of our value-based care models and not coming in. Okay, well, if that's the case, then it would sure help us to get that data. But oftentimes, if we're going to reach out, it's the marketing group that owns the digital tools, but it's the medical group that owns the data. So we need some collaboration to give us the data that we need to do it. By the same token, if the marketing group is then going to reach out to those people, it would help immensely if we could say, hey, Dr. Chris was thinking about you and notices that you haven't been in 18 months, really important at your age and stage in life to be coming in, and here are some just general things to consider. Come on in. Okay, well, great. Well, the marketing group wants to use the medical group's doctor's name, so we have to collaborate. And then even if we are able to stimulate demand, we have to make sure, the marketing group has to make sure the medical group can accommodate the demand. Right? And it's not as simple as saying, hey, our primary care guys are only going at 60% utilization. If we send you a bunch of annual wellness appointments, but you don't have them slotted on the schedule, well, we don't have anywhere to put them even though you're available. So now we have to also talk about capacity, right? So getting the groups together is critical to making things work, because our capacity, our data, our tools, right, are spread out across different places, and we don't always bring them together very easily.
That's a great point.
Yeah, definitely an excellent point. So we have definitely gone over a little bit, but I just wanted to just hear some final thoughts on. I think that there's been a lot of learning today, right? So one thing that I think a lot of people might come away with is we should couch our data-driven efforts in terms not of of bringing the data together and calling it done, but what kinds of actions and what kind of influence are we going to have on the actual behaviors and outcomes. So my real question is just for Matt, Mike, just share any final thoughts that you have for people that are at different points in this journey of going down a 360 experience.
No, look, I think you nailed it. I mean, look, it's make sure that you're thinking about the outcomes and the actions that you want to drive. Make sure that you're thinking about it in terms of a roadmap or a journey, not just one solution and gone. Trying to learn from other industries, right? That doesn't mean that you as an individual need to learn from other industries, but you're at least banking on those that have done research, have looked at it, and trying to culminate those best practices. I think those are three things. The final one that I would leave everyone with is just make sure that you're not assuming that these initiatives, again, are multiple millions of dollars, multi-year efforts, right? I think that gets people in trouble, and that's why these things don't occur. These are things that any health, we worked with organizations that anywhere from one doctor to thousands of doctors, the same solution, right? It is scalable based on the type of organization you are, and that's the beauty of where technology is nowadays. It's highly scalable, but also highly efficient.
Yeah, for me, I'll keep it really simple. It's all about personalization, right? The goal of all this data is to be able to personalize the experience. Every other consumer service industry of scale has proven that, right? If you personalize well, you create value, you create loyalty, you create value for your members/patients. And if you do that well, you create lifetime value for the health system, whether you're the payer, the provider, right? So personalization is everything, and we have to be going after it. And with that in mind, you need a partner who can help you roadmap how you get from here to there.
Okay, well, big thank you for coming on and sharing time with us, sharing a little bit more time than we bargained for with us too. So thank you for that. For those who enjoyed, we'll get to spend actually a little bit more time with Silverline coming up on August 11th. We have a webinar that was inspired by a recent article that Dr. John Glaser put out on the need for intelligence-oriented experiences within healthcare instead of transaction-oriented. So we're going to delve deeper on that, on enabling intelligence-oriented experiences on an hour-long webinar that's going to be on August 11th. So look forward to that. We'll actually have Dr. Glaser on as well on August 14th. So keep an eye out for that as well. And if you follow our YouTube and follow our blog and page, then you'll find a ton of research that we put out. We make this available publicly just for health systems and organizations that are trying to improve the patient experience and improve engagement. The things that we're learning along the way, we share out with the market. So use as data-driven stories and research for the things that you're trying to accomplish. With that, thank you again for spending the time with us, and we look forward to seeing you next week.
Thanks, everyone.
Thanks, Chris. Thanks, Matt.
Thanks, Chris.